In November of 2018, Alex Smith suffered an injury to his leg that would change his life and alter the course of his career. Smith underwent 17 surgeries in an effort to save his leg after being diagnosed with a life-threatening condition known as sepsis. Welcome back everyone to your #1 source for learning about everything related to sports injuries and sports medicine news. In this video, we're finally going to talk about Alex Smith's leg injury, specifically focusing on this life-threatening condition known as sepsis. We'll go over what it is, what it isn't, how you treat it, and just how serious it was for Smith. Make sure and go subscribe if you like this type of content and want to stay up to date with my future videos, and let's get started. Smith suffered a compound fracture to his right leg on this tackle in November 2018. A compound fracture means the bone came out through the skin, and after the initial successful surgery, Smith developed an infection in his leg that ultimately led to this life-threatening condition known as sepsis and a report of 17 surgeries in an effort to save his leg. We saw him with this huge contraption on his leg called an external fixation device, and we've been able to see bits and pieces of his rehab as he still works through in an effort to try to get back to the NFL. Alex Smith's life was certainly in danger after he developed sepsis in his recovery. By definition, sepsis is a life-threatening condition in which the body's response to an infection becomes dysregulated and starts to damage its own organs. A lot of people equate sepsis with bloodstream infection, but that's not correct. You don't have to have an infection in your blood in order to have sepsis. You can have an infection anywhere in the body, whether it's the lungs, the skin, the muscle and soft tissues, like was the case with Smith. And yeah, sometimes you can have an infection in the blood, but that's not required in order to have sepsis. During Smith's recovery, some sort of pathogen, presumably a bacteria, got into his incision and his surgical site, causing an infection in his leg. As a result, this infection triggered his body's immune system to try to fight it off. Sepsis develops whenever the body's response to that infection becomes dysregulated and out of control, eventually causing different changes throughout the body that damage your different organs. There's a lot that goes into the pathophysiology of sepsis, including both pro and anti-inflammatory mechanisms, but the majority of time when we see damage to the organs, it's because the blood pressure in the body just begins to crash. That immune response causes the blood vessels to dilate, your blood pressure begins to drop, and therefore you can't perfuse and get blood and oxygen to organs like your brain, your heart, your kidneys, your liver, and more. Ultimately, if the blood pressure is not corrected and the infection is not controlled, you can have end-stage damage of those organs, which can ultimately lead to death. Let's take a little bit of a history lesson to understand how we classify and actually diagnose sepsis. The first criteria relied on something called SIRS, which stands for Systemic Inflammatory Response Syndrome. Sepsis was then defined if you were SIRS positive, plus there was a suspected or known source of infection. Following along the spectrum, severe sepsis was when you had sepsis plus signs of end organ damage like kidney failure. And then septic shock was when your blood pressure was so affected that you had to be put on medications like norepinephrine to help augment and increase your blood pressure. Now, any medical students out there watching know that SIRS criteria is becoming outdated, and now we're using something called SOFA, or the Q-SOFA. In 2016, there was a big effort to sort of redefine and reclassify sepsis. Part of the criteria relied on something called the SOFA and the Q-SOFA. SOFA stands for Sequential Organ Failure Assessment Score, and it's used as a mortality predictor in patients who are sick in the hospital. The SOFA is the longer version, and the Q-SOFA has just 3 different categories that are used to predict these outcomes. So the new criteria for sepsis got away with this SIRS criteria and removed this idea of severe versus regular sepsis. Now, if a patient has a suspected infection and meets this Q-SOFA and SOFA criteria, they're considered to have sepsis. If you have sepsis, but you develop persistent decreased blood pressure that requires additional medications to support your blood pressure, that's when you have septic shock. So just how serious is sepsis? Long-term data suggests a mortality rate with sepsis around 25 to 30%, depending on the country and the research. This mortality rate increases to 40 to 60% in someone who has septic shock. Thankfully, though, we're getting much better about recognizing and treating sepsis and septic shock with much earlier intervention. Since 1991, research has found that mortality rates from sepsis are declining around 3% per year and are continuing to drop as we develop better, quicker treatments. This mortality rate, of course, is also influenced by a person's age and health, and so someone like Smith is going to have a lower risk of mortality from sepsis compared to a 60 or 70-year-old who might have had some pre-morbid condition before they developed the infection. Treating sepsis is all about early recognition and early intervention. We start broad spectrum antibiotics to cover any potential infection and then narrow those antibiotics down once we've identified the source. We give IV fluids to help support the blood pressure and perfuse those organs, but if these fluids aren't enough, then we put people on medicines like norepinephrine that help support and augment the blood pressure and the heart rate. There's no doubt this was a very serious situation for Smith. Now that this is behind him, he still has a very long road ahead in terms of his recovery from a functional standpoint and the question of whether or not he'll be able to play again in the NFL. We'll take a look at Smith's functional rehab and try to talk about the chances of him playing again in a future video, but I hope this one was educational to talk about this idea of sepsis and this life-threatening condition that Smith had to recover from. Thank you as always for watching, everybody, and I'll see you in the next video.